Welcome to the WebMD Health Discovered podcast. I'm Dr. Neha Pathak, WebMD's Chief Physician Editor for Health and Lifestyle Medicine. Today, we're going to discuss how rising temperatures and extreme heat can impact our medications. We'll take a step-by-step approach to understanding how heat impacts the effectiveness of certain medications and also how it may increase heat-related illness risk as a potential side effect during times of high temperatures. We'll explore how some medications themselves are impacted by heat and the best ways to store medications, especially those that require refrigeration or careful storage. We'll also discuss how to have conversations about our medication concerns, questions about potential dose adjustments, and side effects of our medications with our prescribers and pharmacists. Whether you're planning to travel, navigating extreme weather conditions, or just want to take a proactive approach to your medication management, this episode is full of practical tips to protect your health and your prescriptions. First, let me introduce my guest, Shailaja Sajwani. Shailaja is a pharmacist who works within areas of oncology, climate change, and global health as they relate to the pharmacy profession. She's currently an adjunct professor at the University of Ottawa and the national co-chair of the Canadian Association of Pharmacy for the Environment, CAPHE. She also worked for many years as an oncology pharmacist at the Ottawa Hospital, with 10 years of experience in a combination of outpatient and inpatient oncology. She also co-chairs the Ottawa Hospital Pharmacy Environmental Committee. Shailaja co-chaired the International Pharmaceutical Federation Policy Committee, which created and passed the first ever international pharmacy climate change policy in 2023, which went to over 100 countries, representing 4 million pharmacy professionals. She also represented the University of Ottawa and CAPHE at the United Nations COP29 conference in 2024. Shailaja is currently the co-founder of Climaceutics Health Solutions, which focuses on building tools and certifications for pharmacies to reduce their emissions and improve their climate resilience. Welcome to the WebMD Health Discovered podcast.
Thank you so much, Neha. Thanks for having me.
So before we begin exploring the main conversation that we want to have today around extreme heat and medications, I'd like to ask about your own aha moment around the work that you're doing. How did you come to realize this important intersection is where you wanted to focus your energy?
Sure. So there were two things that happened. The first is that before working in the climate change space, while I was working as an oncology pharmacist, I would do a lot of volunteer work within global health. So I would be involved in Pharmacists Without Borders Canada as a volunteer within their governance. And then occasionally I would go myself as well on a medical trip, for example, abroad. What I ended up finding out was that it really struck me the inequity that was there within global health settings. And I really started understanding the impact of extreme weather events and of climate in general to the health of patients in different countries. The other thing I started noticing is that extreme heat in particular was a huge factor in terms of affecting health first from a wider global setting. And then second, I started noticing it more and more within Canada as well. So I thought, okay, this is a way for me to think about global health on a macro perspective, and then also start thinking about the health of my patients in the oncology setting as well.
That's really great. So today we're really going to focus on extreme heat and medications and look at both of those lenses. In the news, you cannot get away from heat domes impacting various parts of all of these various regions in the US, Canada, globally. So really curious if you could first help us understand, how do you think about medication management when you're thinking about extreme heat?
Yeah, so that's a great question. So I tend to separate it into two categories. So the first category is the actual quality of the medication itself. So let's say if the medication is left in a car and it's really hot outside, or it's left in a home where there's no air conditioning, so what are the temperatures inside that home and what happens to the medication itself. The second is related to what happens when it's a hot day outside and we're taking our medications, and what are the impacts to the side effects of those medications and how that medication actually works in one's body. Those are two very different categories, but they're a great starting point.
So then let's dig into the first piece. So tell us what we should know about some medications, particularly those that are so common out there, from the albuterol inhaler that someone might be using to insulin. First, what medicines should we be thinking about in this category? And how do you counsel your patients around the risks when you're thinking about an extreme heat event that you're in the midst of or that's happening?
Right. So there's various classes of medications, but you can think of this quite broadly to think about, all right, are there specific medications where they say to refrigerate it? Are there specific medications where it's said to keep it at room temperature? And that particular recommendation that is in the literature, in that little patient information leaflet that you get inside the medication bottle or inside your bag that comes from the pharmacy, that recommendation of room temperature versus refrigeration comes from how the medication itself was developed and was tested for effectiveness. So let's say it was tested at room temperature, and we are now in a situation where the temperature is far beyond room temperature. That basically means that the integrity of that medication might be compromised. So you might have a situation where, let's say, it's 80% as effective or 60% as effective or not effective at all. Really, the unfortunate part of this is that we don't actually know enough about the safety and the effectiveness, especially the effectiveness. The safety, okay, we know a little bit more, but the effectiveness itself, we don't know enough about the effectiveness, about the percentage of effectiveness that can happen at specific temperature ranges. That testing is starting to come out in certain studies now, but typically when a medication is approved for effectiveness, they're not looking at effectiveness at other temperature ranges. So that also applies to refrigerated medications. So let's say a medication is effective if it's kept in the fridge and then it's stable outside of the fridge for a certain amount of hours or days, but not more than that. That basically means that if there's a power outage or if there's a delivery where a medication is being sent far beyond the specific pharmacy to a patient's home, we want to make sure that all of that can be taken into consideration with ice packs and cooling procedures. So just certain things to think about. Now, if you are, let's say, in a place where you don't have air conditioning, which can happen, or there's a situation where the air conditioning isn't working, there are still certain ways for you to think about, okay, where is the area in the home outside of refrigeration specifically? Let's say if the medication is recommended to be kept at room temperature, are there places in the home where it might be the coolest and driest area? So we definitely want to avoid, let's say, the bathroom because of the humidity. And we want to avoid any areas where it might get quite hot. Are there places, let's say if you have a basement, can you keep it in the basement? If you are in an apartment setting, can you look around to find out, okay, if it's in front of the window, maybe that's not the best area. If it's in a kitchen cabinet, maybe that's a little bit better. Maybe it's a bit more cooler. But outside of this, there's a whole group of individuals who are now, and organizations who are now actually advocating for the fact that we need air conditioner basically everywhere, that it's considered a human right.
And I think it's so important. And some of the specific tips you gave are so important because so many of us think of our medicine cabinet as that cabinet in our bathroom. So, really key to think about all of the different ways you've advised to safely store our medications, particularly if we don't have air conditioning or if our air conditioner breaks down during one of these extreme heat events. I'd love to shift then to that second piece you talked about, which is potential risks from side effects when you're on certain medications in extreme heat events. So this is something that really worries me as a physician. So we're prescribing these things to help patients, and then we don't want to be part of the reason that people have more complications or side effects. So talk to us about some of the things we should know about some of these classes.
Absolutely. And you're very right to be concerned and worried about this situation. The one thing we tend to talk about in this space is the entire medical curriculum or the pharmacy curriculum or the nursing curriculum has been taught under the assumption of a stable ecological system. So that means that there are very concentrated efforts to update that curriculum to consider issues like extreme heat and how does that affect medication management, for example. So one example of this is that let's say your medication itself can cause a problem of kidney toxicity in the sense that it's a rare or occasional side effect, or it can happen uncommonly, not to everybody, but it can happen uncommonly. Then let's say if it's really hot outside, why do we tell people to drink a lot of water? We're worried that they will get dehydrated. Sometimes with dehydration, the issue is that you don't get enough flow to the kidneys. And that can also cause kidney toxicity. So there's actually an increased risk of kidney toxicity in patients who have medication, which can uncommonly cause kidney problems in situations where it's really hot outside, because you will actually see that kidney toxicity more often. And we call it renal toxicity in our work, but I'm just basically using terminology that will make it a little bit easier. The second area to think about is the situation where somebody has challenges sweating. And certain medication can actually affect how well you can sweat. So a really good example of this is your certain antidepressants, for example, can affect how well you can sweat. So sweating is really important in situations of extreme heat. So if you can't sweat, that's a problem in the sense that it can affect how at risk you are of heat stroke and heat exhaustion. That doesn't necessarily mean you should stop your antidepressant if it's hot outside. It just basically means that you should be monitored more carefully when you are going through these medications. I forgot to say earlier that for what we call the renal toxicity, the medications that can cause an increased risk of renal toxicity, if you haven't heard them up till now, some examples include some medications that we use for heart problems, like ACE inhibitors, diuretics. Some medications that we use for blood pressure as well are also included within that as well. So if you're uncertain, you can have a look at that list of side effects that come in that prescription bag that you get from the pharmacy, and you can have a look to see if renal toxicity is listed as a side effect.
I'd love to ask about any other sort of concerns or medications that you worry about in the event of extreme heat, or if you know it's summer and patients are going to be outside and out in the sun more commonly.
Absolutely. So there are a few other examples as well. So we have a specific terminology in medicine called first a narrow therapeutic window. And what does that mean? That basically means that if you dose it a little bit too high, you can get a lot of side effects. And if you dose it a little bit too low, that means it can sometimes have issues with effectiveness. Any medication that has a narrow therapeutic window, so examples of that include digoxin or your lithium, changes in fluids in your body that happen with dehydration can also impact your toxicity as well. Another really good example is your issues with medications that cause rashes. Sometimes what will happen is that if you go out in the sun and the medication itself has a high incidence of specific types of rashes, you can actually have really significant sun-specific toxicities. So usually in your counseling, in your pharmacy counseling, or when your physician is basically speaking to you, they will say, okay, just be careful if you're spending too much time in the sun, because there can be some challenges specifically with this medication. So these are all things to think about. Another example is if you are on a particular medication like chemotherapy, for example. A lot of specific chemotherapy has also a narrow therapeutic window as well, meaning that if you dose it too low, there's some considerations for that. And if you dose it too high, there's a lot of side effects. And some of them also cause some issues with renal toxicity too. So because of that, we want to be extra careful when we are looking at chemotherapy. When providers themselves are prescribing chemotherapy, they need to be thinking about fluid requirements as well. So sometimes, unfortunately, we're in a situation where things have changed quite rapidly, right? Like we're starting to see heat waves that were definitely not there 15 years ago. And because of that, not all providers are going to be thinking about this on a daily basis. So the best way, the biggest takeaway that I can think of with regards to this category is to say that speaking to your pharmacist or speaking to your physician, I know it's going to be really hot outside. Are there specific considerations with my medications that I need to be concerned about? And that will basically clue in anyone who's not already thinking about this.
It's, I think, really important to know, one, to anyone who's listening, that health professionals are starting to recognize this. And two, to your earlier point, we don't yet know what that means for adjusting your doses or, telling you take something or stop taking something. That's not necessarily what we're suggesting. It's just right now, it's more of just an awareness that there are potential interactions. And if you know that, maybe on that extreme heat day, when you get that alarm on your phone saying, we're in a heat wave, that hopefully alarms you to think, hey, I actually am on a bunch of medications. Maybe I don't go out and exercise today for such a long period of time. Or maybe I really need to make sure that I'm hydrating myself or making sure I'm storing my meds properly. Are you seeing any sort of systems that are sending out alerts directly to patients to kind of give them that information?
We're seeing a mixed bag. So on one end, you can subscribe, for example, to the weather network and they will have notifications to say, okay, it's really hot outside. We are starting to see some public health advisories, for example, on websites. So Health Canada you know, will have certain things about heat on their website. Similarly, other groups have this as well. It's interesting that you mentioned this because groups like the Canadian Pharmacy Association have also been starting to put out infographics in collaboration with the Canadian Association of Pharmacy for the Environment on heat and medication management, let's say to pharmacists. One thing that we are trying within Climaceutics is thinking about the pharmacy also as a medium for sending out information like this too. I really like that you mentioned that this doesn't necessarily mean that you should stop your medications because this is really, really critical because there could be other complications related to stopping your medications. I think the first two major takeaways that I can think of are number one, just thinking about, okay, if it's really hot, do you want to be going outside for long periods of time or not? Are you thinking about your hydration? Are you thinking about your sunscreen, your hat, all that stuff? And then second, are you speaking to your provider about it? Whether that be your physician, a nurse, your pharmacist, but also when you get to the pharmacy, mentioning that, oh, it's really hot. Would this affect my medications and my medication side effects as well? Because typically, again, with pharmacists, they're typically thinking about the heat affecting the quality of the medication as well. We are working on more education on the side effects specifically as well.
And I think something that is really interesting to me, generally, when patients are taking one medication, they're not just taking one. There's potentially two, three, four, five, or more on board. So now we're talking about heat, we're talking about polypharmacy, so multiple medicines that are on board, underlying health conditions. So it can get pretty complicated pretty fast. I'd love to kind of get your guidance on how to slow down and have that conversation with your pharmacist when you're picking up those medications.
So in Canada, we have something called a meds check. It's basically a medication review where you can book something like that with your pharmacist and they will go through each of your medications and basically review the dose, but also review, okay, what are the side effects? What are you experiencing? Is there a current indication for that medication or not? And something like that is very helpful to do in the middle of a situation like this, for example. One key thing that we recommend to providers, for example, is to increase monitoring with regards to lab tests, particularly in the inpatient setting as well, but also in the outpatient setting, like increasing your monitoring of these patients during this time. So I don't know the US specific terminology for MedCheck, but I think if you mention medication review, it's very similar. And you can book something like that with your pharmacist as well.
I love that advice. So we definitely, in the primary care setting, we're always trying to do a medication reconciliation, but I think that you don't necessarily have to wait till that annual checkup. I love that recommendation of really sort of thinking about it proactively. And then as you were talking, I was also thinking about myself as a caretaker. So often I'm going to pick up the medications for my 88-year-old father, and I'm going to pick up the medications for my mother. And so I think when we are in that caregiver role, it also strikes me to really do a couple of things. So to build on what you're saying, but also to check in with our elders during this time frame, because they're not necessarily going out of the home, but they may not know that there are these risks. So they may be in a situation where their air conditioner breaks down, or if you're like my parents, they like to keep it 80 degrees no matter what time of the year it is. So, just to talk to them as well about some of these impacts.
Absolutely. I can't emphasize how important this is because, along with the impacts of heat to medication management and medication quality, you also have the heat impacts to the conditions themselves, right? And even if the person was not taking any medications, there's elderly are particularly at risk for heat related health impacts. And so keeping a close eye on people who are quite vulnerable, I think is really important. Kids, babies, people with chronic conditions, young people in general, but also people with chronic conditions, pregnant people are all at risk related to heat related toxicities. And typically, health related agencies will have specific recommendations related to each of these groups as well.
Love that. Such important advice. And to really sort of think about again, you talked about that therapeutic window, but we're also talking about sort of a smaller window of risk at a certain point when you have these complications. So whereas you might have gone from being able to push yourself in the heat had you had no other medical conditions, no other medications on board. But as you sort of put more and more sort of conditions on board, you're at an extreme of age, you have medications on board, that sort of window to tip yourself into dangerous conditions can get really small. So important to recognize all of these risks. Is there any final thought you want to leave for our listener when it comes to what they should be thinking about, what they need to know about their medications, particularly in an extreme heat event?
I would just say, so remember with regards to refrigeration in particular, so there can be a situation where your refrigerator, for example, doesn't have power. So just having a plan for if the refrigerator were to go out, how would I keep my medications cool for a certain period of time? And does my city have any kind of cooling centers that I can go to just walk around? Let's say if I lose my air conditioning or if I don't have air conditioning. I would also say that I feel like there are a lot of equity issues here too, where, certain populations have less access to air conditioner than others. You also have multiplying effects with regards to, let's say, if you can't afford your medications and therefore you have conditions that are not treated, and then you have heat on top of that. So there are groups, including the Canadian Association of Pharmacy for the Environment, that are also particularly thinking about equity issues on top of this. The last thing I will say is that it's an unfortunate what's happening, right? What we're trying to do is look at reducing emissions, and now the climate crisis is here, and we're also thinking about how to manage extreme heat as well. One thing I have found quite fulfilling is trying to reclaim the agency I do have in this situation, especially when extreme heat does happen, to say that, okay, these are the steps I'm going to take when it's really hot outside for my family, for my patients. And I find that that reclaiming of agency in particular situations can be particularly helpful for mental health as well.
That's just so tremendously helpful. And I think, you mentioned this earlier as well. I think it's important for us to not think about these risks as something that increase just when there's extreme heat, but we're having just warmer temperatures earlier and for longer periods. So there's also some of the risks of complications if you're on these medications, even if you're not getting that alert on your phone that we're in the midst of a heat dome. You really need to be having this conversation with your pharmacist or your healthcare professional, I think earlier than when summer traditionally started for you when you were younger.
Absolutely. I just wanted to say maybe one last thing about the oxygen mask. So sometimes I can identify with this where one might think that, okay, I have these people who have really difficult conditions or they're vulnerable who I care about. And one is not necessarily also thinking about oneself in terms of the hydration, the taking care in the heat. And we are all vulnerable to this, right? I think just making sure that one thinks about just the basics with regards to managing oneself in extreme heat, and then that will make our mental health and our physical health better enough to be able to also help others as well.
I love that point. As a mom, sort of sandwiched between everyone else's needs, I definitely have packed my kids' water bottles and then not even given a thought to my own
Yeah.
water bottle. So I love that. And I thank you so, so much for your time.
Thank you. Thank you for having me.
My key takeaways from this discussion are that extreme heat is something that we need to worry about for our health, but also for the effectiveness of our medications. Medications are tested and approved under controlled temperatures. So when they're exposed to extreme heat or poor storage conditions, they may degrade or lose potency, potentially making them less effective. Medication side effects can also be amplified by heat and increase the risk of dehydration, kidney problems, especially because some medications impact our ability to sweat and how tight our blood vessels get. Your prescriber and pharmacist play a key role in heat related medication management. Ask questions, communicate your concerns, and discuss appropriate medication storage and management plans if you're anticipating or in the midst of an extreme heat event. To find out more information about Shaliza Sajwani and all of her work, make sure to check out our show notes. Thank you so much for listening. Please take a moment to follow, rate, and review this podcast on your favorite listening platform. If you'd like to send me an email about topics you're interested in or questions for future guests, please send me a note at webmdpodcast@webmd.net. This is Dr. Neha Pathak for the WebMD Health Discovered podcast.